Stephen Dias. I'm a gynecologist and obstetrician, and I'm also endocrine surgery expert and infertility expert. Today, I'm here to address the issue of how to know about your reproductive health. Many times when I'm addressing the patients in India, many of them do have the infertility issues. So I thought of doing this particular small series wherein I would like to highlight which are the areas wherein you may find the problems in and which can be called or which may be associated with the infertility. So let's get started. First and foremost, before going into these problems, I would like to just introduce about your reproductive system. Now, most of you will be aware of it, but just to brief you about is your reproductive system basically will comprise of the following regions. The first and foremost is your vagina. Next comes is your cervix. The next comes inside the cervix is a cervical channel. Then will be your uterus itself. Then will be your fallopian tubes, and then ultimately your ovaries. Now, this is your fundamental reproductive system. Now, in this particular reproductive system, the problem can arise at different places. And these problems can ultimately result in an infertility. The first and foremost, a problem can come in the ovary itself, which are responsible for the production of the egg, which is a vital component to conceive. So the problems associated with this could be you are not producing enough number of eggs, you are not producing healthy eggs, or they are not up to the size which will enable them to ultimately fertilize and go for the next process. Or at times there are some hormonal issues which doesn't produce a quality egg. So all those kind of problems will be associated with your ovary part, and there are two of them. Next problem can be associated with this channel through which ultimately your egg is going to traverse, and the possible problem that the channel can have, which we basically call it as the fallopian tubes, is you might have some blockages in these particular tubes that can prevent the movement of the egg along these particular tubes, and which will further hamper the fertilization process. The problem can also lie in the uterine lining itself, provided the fertilization has occurred and then the particular fertilized egg has to implant here. And if this lining is not proper, then over a period of time, it can get shedded off. And ultimately what you see is a miscarriage. So the problem itself can lie in the environment here itself. Further, the problem can also lie in this channel in the initial stage where through which the sperm has to traverse in order to fertilize your egg. So the problem can lie at this stage also. So probable problems, if I note it down, it can be at ovaries, it can be at fallopian tubes, it can be in your uterus itself, it can be in your cervical channel itself, and might be in the problem can lie in this environment, that is your vaginal environment itself. So these are the 5 problems where usually a woman can be associated with, and it is ultimately may result in infertility in women. It's not necessary that just a woman may have one problem. Many times there are cases wherein more than one problem also exists at different places. So it becomes a very challenging task for the doctors to address them, to diagnose the appropriate problem and treat it. So a good diagnosis based on the symptoms observed are very much important from the doctor's perspective to analyze where the problem can lie, and then appropriate corrective steps can be taken up to overcome it. Also, having mentioned this, one more thing I would also like to highlight is you need not worry if you have infertility, because in the modern era there are a lot of treatments available, inexpensive treatments available, which can be applied to correct these infertility issues rather than going for the expensive one like the IVF. Myself being also a doctor, and if you take my fair opinion, I would suggest the last option to try is IVF and not the first one. Having said that, let's move to the next stage and see your menstrual cycle. So in this phase, I'm trying to explain you what is your menstrual cycle is all about. Many times when I consulted the patients in the Asia region as well, for most of the women, the menstrual cycle only implies those 4 or 5 days of the bleeding. Apart from that, they have no clue about what their body is going through from the one menstrual bleeding to the next one. So this is very important to know for each and every woman. That's why I would like to spend some time in explaining you actually what happens from your one cycle to the other cycle. So let's get started from this diagram, which I marked as 1. This is a particular phase wherein if you see your flow is going to start or your menstruation is going to start. And we term it as the menstrual phase, wherein the thing that happens is we basically shed the endometrium, which is the inner lining of your uterus, and that's why you see the outcome of it in terms of a blood or the clots. And it continues for some women. It may be 2 days, it may be 3 days, it may be 5 days, and so on. But any particular flow more than 5 days needs to be taken little bit seriously. Next, once this thing is over, we go to the next phase, which we term it as a follicular phase. Now in this particular follicular phase, what is happening is the development of the egg in your ovary is going to take place. Now when I say a development of egg is taking place, it is not that the egg is only developing only in this phase. What does it mean is now the egg has reached a very good developmental phase so that it can make a transition from this phase to the next phase. The development process of the egg starts even when you are particular bleeding in the previous phase, but it has reached to a particular point good enough so that it can make a transition from this phase to the next phase. So that is the important component that happens in this phase. At the same time, if you observe, your endometrium, which is nothing but an inner lining of the uterus, it also starts to develop. In this phase, it was completely shedded off, but now it is again starting to develop to prepare for your pregnancy if it happens. So your body is now preparing for you to conceive in your next cycle. So the lining, which we term as endometrium, it also starts to develop in this phase. As you make a transition from the follicle phase to the next phase, that is ovulation phase, the egg that was developing is being released into your fallopian tube. Mind you, in a month, only one egg will be released, either from the left ovary or the right ovary. The moment the egg is released in one of the ovary, it sends a signal to the body to prevent the release of the egg, which might also have been matured in the other ovary from releasing. So in one cycle, one of the egg will be released from any one of the ovary. And that is what actually happens in the ovulation phase. And this is the ideal phase for the couples who are trying to conceive to indulge in the sexual activity so that the fertilization can take place. The second important thing that also happens in this phase is the lining of your endometrium tends to become more and more thick compared to the follicular phase. So the significance of the ovulation phase is the release of the egg, and the ideal window that you get for the fertilization of the egg, and that needs to be tracked properly for the couples who wants to conceive. So I claim this from the couple's perspective who wants to conceive as a critical phase. Further down the line, we go to the next phase called as a luteal phase. Now in the luteal phase, the egg has traversed all the way through the fallopian tube and it has reached your uterus. Now when you go into a luteal phase, the thing that happens is, no doubt, even if you indulge in your sexual activity, there are very less chances, almost nil, for that sperm to fertilize this particular egg, even if the sperm comes in contact with the egg. The very fact reason behind it is the egg structure by the time it reaches here and by the time you are in luteal phase, the structure of the egg has changed, which prevents the sperm to penetrate through it and to carry out the fertilization. And the egg is simply going to wait here for some days, and then again your next cycle, that is the shedding of this endometrium lining, takes place, and again you see your menstrual flow coming in your cycle. So to summarize this, your menstrual cycle will comprise of 4 phases. One is the menstrual phase wherein you see the bleeding, the follicular phase wherein the egg is trying to reach the maturity, ovulation phase wherein the egg is released and looking out for a fertilization process to happen, and the luteal phase, if the fertilization doesn't take place, then the egg remains here, and then ultimately in this phase it goes into the transition and the shedding of your lining also takes place and you see the blood coming out of it. Again, in the luteal phase you find that the endometrium lining will be maximum in terms of its size. So to put it little bit more clear, I would highlight this here in terms of more linings, because the body was preparing for you to conceive, but it has not happened, and ultimately that lining is being shedded off in terms of your blood flow in the next phase. So this gives you a rough idea of what your menstrual cycle all is about. Now let us move to the next slide and see the egg formation. So I am now focusing on the ovulation phase, and I would like to highlight some components regarding the egg formation, because it is one of the vital component in order to, from the female perspective. So let us see in detail what is egg formation process is about. So what I have shown here is the ovary. I have just shown one of them, and the same thing also happens in the other ovary. So basically this is the egg development process that you see. So we have primordial follicle, which further gets converted to primary follicle, then it goes to secondary follicle, then the follicle gets matured, and then ultimately once it's matured enough, then during your ovulation phase, one of the egg from one of the follicle will be released and your ovulation process will start. So this process that you see, that is a transition from this to this, that is from primary, secondary and mature follicle, is nothing but happening in your follicular phase that I explained before. And as the matured egg is trying to be released in your fallopian tube, that time we make a transition from follicular phase to an ovulation phase. Now, here I have just shown the development of one follicle. It doesn't mean that your ovary will have only one follicle. It might also have one follicle in some cases, but usually there are multiple follicles that are in the different developmental phases. And again, mind you, this doesn't happen in 1 month. There are different follicles also here which will be developing along with these other follicles, and they might be in different stages. So might be the follicle that is developing here might mature and it will be released maybe in your next cycle. So don't misinterpret it in terms of 1 month cycle, that only one follicle will be developed and it will be released. So there are multiple of them going through all this process simultaneously. And then ultimately in a normal scenario, once the egg is released, then the remaining part gets destroyed in terms of the corpus luteum and the corpus albicans. and so this is the destroyment part of the remaining part. So this is a healthy ovary, the functioning of an healthy ovary. Now, since the diagram also has a mention of polycystic ovary, and this is also nowadays quite common, we basically call it as PCOS or PCOD. In them, what happens is basically it's an ovarian disease. So in this, what happens, if you see here, the development of the particular follicles do take place, but after some time, the development stops. So if you see in comparison to this phase, the secondary follicle never develops into a mature follicle in case of a polycystic ovary. They remain as it is, and you tend to get multiple immature follicles like this. As such, they are not that matured enough to be released, and even if they are released, they are not matured enough to be fertilized, or even if they get fertilized, there are very less chances that it may continue and develop into a healthy fetus. So this is a problem that is associated with most of the cases of the women who have the PCOS. So just as we were discussing about the ovary, I thought of also explaining you this, what actually happens in PCOS. So this follicle development process stops here, and you tend to get multiple follicles here which have been developed, and they could not ultimately develop into a mature follicle, and ultimately the matured egg could not be released. That is what is a problem associated with the woman having PCOS. I will also be doing another session on PCOS explicitly, wherein I'm going to go into more depth associated with this. Now, having discussed egg formation and having known why egg is very important and how its development process takes place during your 1 month cycle. Fine. Let us go to the next topic and see about your menstrual cycle and its 4 components which I have already highlighted. So here I have shown a typical 28-day menstrual cycle. One more thing I would like to make a mention here is basically ideally we take a menstrual cycle as 28 days, but in a woman's lifespan, she may not always get a menstrual cycle of 28 days. There will be always some variations, and if the variations are within a particular bound, they are very much accepted. Let me spend some time in explaining you the bound. Some women may get the menses after 26 days. Some women can get the menses after 32 days in 1 month or always. Some may take about 35 days. So anything in this window is normal. So if your menstrual cycle is varying in between this window period, it is considered as a normal. Now we take one more parameter into it, and we take about the count of the number of periods that you had in 1 year. So it can be counted at a yearly level or also at half yearly level. That gives you a rough indication in which direction you are moving. For instance, if your cycle is always 28 days, then most likely you are going to get around 12 periods in a year, or 12 menstrual cycles in a year. On the other hand, if your cycle is, let's say, 26 days, then you are bound to get around 13 periods in a year. And on the other hand, if a menstrual cycle is about 32 to 35 days, you may land up in getting, say, around 8, 9 or 10 periods in a year. So what we do is, if these levels are in this range, so I would put it like this, we can take it as 9. So as long as you have a number of cycles from 9 to, let's say, 13, or at the most 14 is also allowed, but not above that. So if your count of the cycles in a year are within this particular bound, we can consider you as normal. And mind you, No one is going to get every month 28-day cycle throughout your lifespan. There are always going to be some variations. So it is important to note down this and count how many number of cycles you have in a year, or maybe a half year, you just divide it by 2 and try to find out where you fit. So within this range, it is considered as a normal. And if the number of count becomes more lower the count means you are getting the periods after 35 days, maybe 40 days, 50 days, or once in 2 months and so on, then your count will be very low in a year. If you are getting too frequent periods, like 2 periods in a month, then this count will shoot up. So that is an indicator that there is some problem. Okay, what are those problems? I may address you in one more session in the coming future. So now let us go to a typical 28-day cycle scenario, and I already explained you the 4 phases. So the first phase is a menstruation phase wherein there is a bleeding. Here we have taken an ideal window of a bleeding of 1 to 7 days. For some of you it may be less than this, but maximum it should go till 7, including the spotting whatever you see. So the maximum window that is taken is 1 to 7. Then you make a transition from menstrual phase to a follicle phase. Now, as I had pointed out before, although we term it as a follicle phase because it is in the phase wherein the egg is almost trying to reach its maturity level, but as I told you before, the development of the egg starts before. And that's why if you see in this diagram, this entire half circle that is represented in blue is nothing but it's a follicular phase. So egg development has started even when you are actually bleeding. So we term entire this phase as a follicular phase, but this is the ideal phase wherein the maturity of the egg is going to take place. Then once you are finished with the menstrual phase, you are making a transition to this follicular phase, what I explained you in the previous slide. Now, for the couple who are trying to conceive, you can start conceiving from or start having an intercourse from this day itself. Probably you can leave 1 day or so, but ideal way is you start trying from 8th day onwards. If your cycle is not of 7 days, and if it is, let's say, of 5 days or 4 days or 6 days, leave some 2 days gap and then start trying. And one more request I would like to make you is please don't try any mobile app which helps you with your ovulation tracker, because most of those apps are built up by taking ideal data into consideration, but each one's body is different, each one's menstrual cycle pattern is different, so you need to analyze it yourself. And over a period of time I will also explain you some of the simple tools and techniques that you can try out yourself without the help of anything else to track it. So you can start trying from this day itself. So try conceiving it. Now in this ideal window of 28 days, the ovulation may occur from 9 to 10 day onwards, and that particular egg that is released, it may remain in the fallopian tube and may traverse ultimately through the uterus, and that window you may get around 4 to 5 days. So 10 to 14 is your fertile window. So it's the best chance for conception. It doesn't mean that you cannot conceive here. You can do so. It doesn't mean that you cannot conceive here. You can do so. So try to increase this window period that you have in order to conceive, and don't just stick to 2-3 days. No doubt those 2-3 days are vital, but continue the process throughout this phase, and if you are lucky enough, then definitely you have a very high probability of conceiving in that cycle itself. Some couples do take a gap of 1 day and have the intercourse activities. I would recommend please don't do that. Try to have it at least once every day in this phase, because it is very critical. Further down the line, so this is the phase wherein your ovulation will take place. and till here, till 16, there are very high amount of chances of you also conceiving, but the fertile window being 10 to 14, and it may, the schedule itself may work, may change based on your number of cycles. If it's 32-day cycle, then this may get shifted little bit. Okay, that you need to analyze yourself, and probably in the later stage I will explain you how to do it. So from the ovulation phase now, from this onwards, you are making a transition to a particular luteal phase. So in this particular phase, it will last all the way from here to this particular point, and at that particular point there won't be any particular fertilization to take place. So that is very important. Fine. So we'll, in this particular part, if you try to have the sexual activity, then there are very less amount of chances of having it. So that's why the people who not try to particular conceive, they try to avoid, who wants to prevent the pregnancy, they try to avoid it by preventing the sexual, or by indulging the sexual activity in this phase, so that they do not conceive. But for most of you who want to conceive, this is going to be an fertile window. So now